Hello, Dr. Puran, I'm audible. There's some problem in this rep. I'm joining from mobile. That's it, Dr. Roster. थैंक यू डॉक्टर पूनम। एक बार पुनः आप सभी का हृदय स्वागत। सर्वप्रथम मैं इसके पहले की प्रोफेसर व्याधवी अपना उद्घोषण भाषण दें और हमें इस ज्ञान से सिंचित करें, मैं सर्वप्रथम धन्यवाद दूंगा। जैसे डॉक्टर पूनम जी ने कहा, पद्मश्री पद्म भूषण हमारे जीवी के मेंबर वैद्य देवेंद्र तिवारी सर का, जो उन्होंने कि बिना हमें किसी बाधा के निरंतर हमें सहयोग किया, निरंतर हमें मार्गदर्शन किया, नहीं सहयोग बल्कि प्रोत्साहन किया, जिसके चलते वो लगभग जबकि उनकी व्यस्ततम टाइम से वो ज्वाइन करते, उपलब्धता के होने के बावजूद भी वो इसमें जुड़ते हैं और समय समय पर मार्गदर्शन करते हैं, जिससे ये प्रोग्राम हम आपके बीच पे लाया पाते हैं। और हमारे टेक्निकल मेंटर डॉक्टर मनोज मिस्त्री सर, जो कि जिन्होंने इस कॉन्सेप्ट की शुरुआत की थी आज से लगभग 96 वीक पहले या 100 वीक पहले। तो जो ये प्रवाह ज्ञान गंगा के रूप में चल रहा है, उनको भी मैं उनका एक तो स्वागत करता हूँ, आभार व्यक्त करता हूँ कि जिन्होंने हमें टाइम टू टाइम गाइडेंस देते हैं कि कैसे और इंटरेक्टिव, सक्सेसफुल, स्टूडेंट ओरिएंटेड, नॉलेज ओरिएंटेड रहा जाए। आयुष मंत्रालय जिसके सहयोग से जिसने की लगातार सहयोग दिया है, हमारे माननीय सचिव पद्मश्री राजेश कोटेचा सर, हमारे स्पेशल सेक्रेटरी श्री प्रमोद कुमार पाठक सर, वो निरंतर हमें प्रेरणा देते रहते हैं और आवेरी को आगे बढ़ने के लिए, इस जैसे और भी प्रोग्राम करने के लिए हमें प्रोत्साहित करते हैं। इस मंच से इसका उपयोग हम आज का तो सेशन सुनेंगे ही, प्रोफेसर व्याडगी के ज्ञान से लाभान्वित होंगे, साथ साथ उनको बताना चाहते हैं कि अभी ने भी आने वाले दिनों में बच्चों के लिए और आयुष करेंगे। जो किसी का माइक ओपन है, प्लीज माइक बंद कर दें। प्लीज स्विच ऑफ योर माइक। तो हम आयुर्वेद आहार की जो नया रेगुलेशन है, उसके लिए एक हम ट्रेनिंग कोर्स करने वाले हैं 3 दिन का नेफ्टम के साथ। अभी हमें उम्मीद है और पूरा विश्वास है इसके लिए मंजूरी मिल जाएगी। ऐसे और कई ट्रेनिंग कोर्सेज, ऐसे और कोई सेमिनार्स हम करेंगे। आज का जो हाइपरटेंशन, जिसे व्यान वाला वैषम्य कह सकते हैं कि नहीं, उत्तरक्त चाप कह सकते हैं कि नहीं, इसके बारे में पूरा डिटेल आज हम विकृत विज्ञान के हमारे मित्र और प्रोफेसर व्याडगी सर से सुनेंगे। इसके पहले हम डॉक्टर व्याडगी सर को सुने, प्रोफेसर व्याडगी को। आई विल रिक्वेस्ट हमारे वैद्य जी, शायद आज जुड़े हुए डॉक्टर पूनम वैद्य जी, हमारे जीबी के प्रेसिडेंट, पद्मश्री पद्म भूषण रघुनाथ सर जी जुड़े हुए हैं। मैं उनसे अनुरोध करूंगा कि कृपया 2 शब्द हमें 2 शब्द कहें और हमें प्रोत्साहित करें, जैसा वो निरंतर करते रहते हैं। वैद्य जी, अगर आप कृपया जुड़ जाएंगे क्या, हमें अपने आशीर्वाद से अभिसिंचित करें।
जी, आरएवी के डायरेक्टर अनुपम श्रीवास्तव जी, आज के जो हमारे वक्ता विद्वान बनारस हिंदू यूनिवर्सिटी के परमेश्वरप्पा जी, हमारे सारे गवर्निंग बॉडी के मेंबर्स, गुरुजन और विद्यार्थी लोग जो सब इसमें जुड़े हैं, और हमारे आरएवी के सब लोग, जितना भी हमारा स्टाफ है, सब लोग हैं हमारे, रामाकृष्ण जी। पहले तो इस 96वां जो है, तकरीबन 2 वर्ष इसको पूरे होने जा रहे हैं, तो मैं सबका बहुत धन्यवाद भी करता हूँ, आरएवी का, विशेष करके डायरेक्टर का मनोज नेसरी जी का, कि वो एक कार्यक्रम लगातार चल रहा है। और ये जो 100वां इसका जब एपिसोड हो, तो इसको विशेष एपिसोड के रूप में बनाएं कि हमारे 100 एपिसोड होने जा रहे हैं। जिस भी विषय पे रखें, इसका आप बात कर सकते हैं। तो ये विषय जो भी आपने लिया है, हाइपरटेंशन, मैं जो हमारे वक्ता हैं, विद्वान वक्ता जो है, उनसे जरूर बात करना चाहूँगा कि आज से तकरीबन कोई 40 वर्ष पूर्व दिल्ली के अंदर जब पूज्य पिताजी ने इसके ऊपर एक बहुत बड़ा सेमिनार किया था, तब इसका नाम मतलब ब्लड प्रेशर का नाम या हाइपरटेंशन है, जो भी है, इसको व्यान बल दिया था, क्योंकि जो हृदय को जो संकोच और विकास करती है, वो व्यान वायु है। तब सारे भारतवर्ष के बड़े विद्वान जो वैद्य इकट्ठे हुए थे, बनारस से भी आए थे, मुझे ध्यान है प्रियवत जी भी आए थे, बहुत बड़े बड़े विद्वान सब इकट्ठे हुए थे। तब ये कहा था कि यह जो व्यान बल है, क्योंकि जो संकोच और विकास करती है व्यान वायु, हृदय को वही करती है, तो उसका जो बल लगता है उसका नाम व्यान बल है। तो यह भी एक, इसको हम अपने आयुर्वेद टर्मिनोलॉजी में लेना चाहिए कि जो रक्तचाप है या हाइपरटेंशन है, ये आयुर्वेद को व्यान बल या व्यान बल क्षय या व्यान बल इसके नाम से जाना जाता है। तो ये इसके बारे में भी कुछ चर्चा हो तो हमारे विद्यार्थियों को, गुरुजनों को जरूर पता लगेगा। और मैं विशेष करके जो हमारे आज वक्ता हैं प्रोफेसर परमेश्वरप्पा जी, उनका बहुत स्वागत करता हूं कि आप इससे आज जुड़े और आप अपना पूरा ज्ञान इससे सारे गुरुजनों को, विद्यार्थियों को देंगे, जिससे कि हम सब उससे लाभ उठाएंगे, ऐसा मेरा अपना मानना है। मैं पुनः विशेष करके अनुपम श्रीवास्तव जी को बधाई देता हूँ कि वो इस पर निरंतर लगे हुए हैं और 2 वर्ष पूरे होने जा रहे हैं। तो मैं फिर दोबारा कहूँगा कि जो 100वां एपिसोड बने, जो भी विषय लें, उसको थोड़ा बड़ा भी कर सकते हैं और एक अच्छा उसका एक कार्य रूप दें, ऐसा मेरा मानना है। धन्यवाद, नमस्कार।
धन्यवाद। धन्यवाद वैद जी, आप हमें गाइड कर चुके और निर्देश देने के लिए। हमने कुछ सोचा भी है वैद जी, हम आपसे अलग से भी बात करेंगे, यूजरों से भी बात करेंगे, अपने जीबी मेंबर से बात करेंगे, कैसे इसको और अच्छे से किया जाए। और और इस बात के लिए विशेषकर कि आपने जो 40 साल पहले जो बड़े वैद जी थे, मुझे भी याद है, उसके डॉक्यूमेंट भी हमारे अरेबी में है कि बयान वाला वैषम में कहा था, वर्ड यूज किया था, जो आपने बहुत अच्छी तरह बताया। और कैसे रोल है संकोच में, आकुंचन में, उसमें ना। धन्यवाद वैद जी, और अपने व्यस्तम समय से निकालने के लिए। मैं अपने भाषण में अपने गुरुओं का, अपने जीबी मेंबर को स्वागत और उनके बारे में कहना भूल गया। मैं इसके लिए माफी चाहता हूं, और पूरा आप सब लोग, सभी लोगों का आरएवी की ओर से, आरएवी के इंटायर फैमिली की ओर से एक बार पूरा पूरा स्वागत करता हूं। और ओवर टू यू डॉक्टर पूनम, आप आज के हमारे जो वक्ता हैं उनके बारे में ब्रीफ आप परिचय बताएं। बहुत सारे लोग जानते हैं, फिर भी एक बार उनके बारे में ब्रीफ बताएं। उसके बाद हम वक्ता के बीच में नहीं आएंगे, हम उनको सुनेंगे। ओवर टू यू डॉक्टर पूनम।
Thank you, Poonam ji, for my introduction. First of all, I am very much thankful to the REV director, my friend Dr. Anupam Srivastav, and I'm not audible now. Is it audible? Okay. I'm very much thankful to you, Dr. Poonam, for my introduction. And I'm very much thankful to my friend, Dr. Anupam Srivastav, for inviting me to deliver the topic on hypertension and Ayurveda. I'm also thankful to Ramakrishna sir and the Professor Devendra Tribuna sir and our Manoj Nesri sir, for blessing me to do good things in my future endeavors. Today, as sir was rightly pointed out that it's one of it's not audible. Now it is audible. It's audible now. Okay, but what about the video is not coming? No problem. I will, no problem. So there was a problem with the Apple laptop, no? Now slides are visible now? No? Now it's visible, no? Okay, today I'm going to discuss about the what are the now it is audible. No problem with the sound. Okay, so today, now I'm going to discuss about what is hypertension and how it can be.
इसके बाद में जो डाइट है इससे हो जाएगा फिर हाँ नहीं 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 हाँ हाँ
There is a disturbance, you know. Hello. Let's start. Okay. I'm very much thankful to my friend Dr. Anupam Srivastava sir, as well as Dr. Ramakrishna sir for inviting me to present the views on my hypertension and the Ayurvedic concepts. I'm also thankful to Vaidya Triguna sir and Manoj Nesri sir for giving me an opportunity to present my views. I'm also thankful to the organizers, Poonamji and her team for nice introduction. So today I'm going to discuss about the what is the hypertension and how it can be understood in terms of Ayurvedic terminologies. So there are big challenges which we are coming across and which we are facing in terms of understanding the concept of this. So why I have chosen this topic to discuss in today's forum is because on 17th May it is celebrated as the World Hypertension Day. So that's the reason I thought that it's better to give some knowledge or some information related to the what are the pros and cons of the effect of hypertension. So it is because why it is important to understand in terms of the treatment, in terms of the diagnosis, because it is considered to be one of the silent killer because of the presentation of this presentation of the clinical presentations are very inaccurate or not visible properly, or the patients will present with the avyakta lakshanas, what we can call it in terms of Ayurvedic terminologies. So you know that hypertension is one of the leading causes of the global burden of the diseases. The people with the hypertension are increasing day by day, maybe because of the change in the lifestyle and change in the dietary pattern. So why we need to understand, or why we need to study the hypertension? Because once you are diagnosed as an hypertension, if it is not properly managed, it is going to be one of the causative factor for the development of coronary heart disease, congestive heart failure, ischemic and hemorrhagic stroke, renal failure, and the peripheral arterial diseases. So that is why the proper understanding and proper management of hypertension is necessary. If it is not been managed properly, so the person will end up with manifestation of these diseases. So as I mentioned earlier, this hypertension is always associated with the additional one of the cardiovascular risk factors. And the another problem is the people with the antihypertensive therapy, we can clearly reduce the risk of the cardiovascular diseases. We can reduce the risk of the renal diseases. We can reduce the risk of the blood vessel abnormalities. So it is the key is to maintain, key is to reduce, and the key is to give the proper advice and medication to the patient. What is hypertension then? In modern medicine, it is defined as the systolic blood pressure of more than 140 millimeter of Hg or more, AR diastolic blood pressure of 90 mm Hg or more, or one who is taking an antihypertensive medication. So there's a history of antihypertensive medications, and based on that, so we can diagnose that particular person as the hypertension patient. So when it comes to the understanding of this pathophysiology of this particular disease, it is very, very challenging and very, very difficult to explain, because 95% of the patients in case of the essential hypertension, it is said to be an unknown etiological factor. Cause is not known in 95% of the cases. So that is why it has been mentioned that it is developed because of the multifactorial and the complex phenomena. So what are the multiple factors which really involved in the modulation of this particular disease? One is the humoral mediators, vascular reactivity, circulating blood volume, change in the blood volume, circulating blood volume, vascular caliber, blood viscosity, cardiac, blood vessel elasticity, and the neural stimulation. So these are all some of the possible explanations what have been given in modern medicine. Another hypothesis or another theories which have been told that the possible hypothesis which can be drawn out because of three multiple factors. One is genetic predisposition. It is very, very common. That's the reason we don't know exactly. Another one is there's a history of excess dietary salt intake. And the third one is adrenergic tone. So in this particular adrenergic system, or we can call it as an adrenergic nervous system. So this particular, it is a group of organs and the nerves, so in which there is an adrenaline and the noradrenaline act as a neurotransmitter. So if there is any defect in this in any form, so that is going to cause the development of the hypertension. So then what is important is you need to ask about the natural history of the essential hypertension is very, very important in terms of occasional to the development of the complete establishment of the disease. And another thing is after a long invariable asymptomatic period. That's what I told, actually hypertension cannot be diagnosed because it has been accidentally diagnosed if the person is undergoing a surgery or if the person is undergoing some medical checkup for some other reasons. So in that particular conditions, once the blood pressure is measured, so that will be developing that will be diagnosed as hypertension by that time. But due to the invariable asymptomatic period to the persistent hypertension, so that is lead to the development of the complicated hypertension. So in that particular, if it has been developed as a complicated hypertension, that is going to cause the end organ damage to the aorta and small arteries, heart, kidney, retina, and central nervous system. So that's why we can call it as in Vyadhi Sankara or the syndrome. Hypertension is a disease. That's why I told it is an earlier. It is one of the silent killer because it is going to affect many vital organs as per the its effect is concerned. So hypertension and the progression, how this particular essential hypertension can be studied. Then question comes whether this particular hypertension can be diagnosed in the initial stage. So that is pre-hypertension in a person's aged about 10 to 30 years by the increased cardiac output. So this may be because of the family history of the hypertension, number one. Number two, the person having a history of the obesity. And number three, there is a history of smoking. Then number four is history of the alcohol intake. And there is a history of the sedentary lifestyle. And the another one is the early hypertension in persons aged between 20 to 40 years. In this particular stage, already there is an increased peripheral resistance is prominent. And the third stage is where the established hypertension is common at the age of between 30 to 50 years of age. And the last one is the complicated hypertension in the persons aged between the 40 to 60 years of age. Next comes about what is the fate of this hypertension that I told earlier. So this 50% are not diagnosed and the 50% at the diagnosis. At the 50% are not treated and remaining 50% are treated and 50% are again poorly treated. And the 50% are well treated. So there is when it comes to the different, if you go to the scenario, if the person will always comes to you once after developing the coronary stroke, ischemia, or stroke hemorrhagic, or coronary artery disease, or the myocardial infarction. So if it has not been properly managed and treated, so the person will present with those presentations and will reach the hospital with those presentations. So when it comes to the understanding of this one in terms of Ayurvedic classical text, what kind of correlations what we can make out for this particular word hypertension in Ayurvedic terminologies. So in my opinion, so this we cannot give any clear-cut diagnosis cannot be given. Nomenclature of the disease is not mentioned in Ayurvedic classical text, but because of the occasional or the avyakta lakshanas or the alpa lakshanas are there, so that was the reason, that may be the reason one. And another one is, in my opinion, when the disease is not properly clinically manifested. So Ayurveda, the strength of Ayurveda is the clinical presentation of any of the disease. But in my opinion, hypertension can be treated based on the guidelines mentioned under the Anukta Vadis. So once you understand this particular concept, it is not possible to correlate the hypertension with any of the concept mentioned in Ayurveda. But even then, so there are certain hypotheses which has been told in the in terms of this particular hypertension, this we cannot say that this we cannot compare with any of the diseases. But interestingly, the people have studied at the different level, and the different kinds of thesis work has been done in the different institutions of India. So somebody has correlated with the Raktagata Vata, somebody has Pittavrata Udana Vata, somebody has Siragata Vata, somebody has Damani Pratichaya, somebody correlated with that of the Pittavrata Vata, somebody has Raktavrata Vata, and somebody has Pranavrata Udana Vata. Still, some of the studies again has been mentioned that in some studies, I was going through some of the work what has been done in most of the publications also, where somebody has mentioned as Ramani Prapurna, somebody has mentioned as Rakta Vikshepa, somebody has mentioned as Vana Prakopa, somebody has mentioned as Raktamanda, Raktamada, somebody has mentioned as Uchay Rakta Chapa, somebody has mentioned as Vana Divala. So there are difference of opinion as they were there in terms of giving a nomenclature to this particular disease. So when it comes to this particular why I don't know, most of the people who mentioned the Raktagata was maybe in possible correlations with that of the hypertension. But here, if we go through the signs and symptoms mentioned under this particular Raktagata Vata, so you don't get the what are the clinical presentations what has been mentioned. In some futures you may get the stiffness of the body after taking food, or maybe some patients will present with the some kind of the anorexia and presentations. So based on this we cannot say that Raktagata Vata can be correlated with that of the, because these presentations we don't get in case of the hypertension patient. So we cannot compare Raktagata Vata with that of the hypertension. Another correlation, what are another words which has been somebody has correlated with that of the Siragata Vata. The Siragata Vata, maybe the reason maybe why the people have been included Siragata Vata under the hypertension, because as the complications of the hypertension, there may be fetal edema is going to develop in the patients. So there will be lots of pulsations along with some dilatation or contractions of the vessel may be seen in case of the some secondary hypertension patients. So that may be the reason this may be the Siragata Vata may be correlated, but not directly. Maybe this as the complications of that particular disease. Somebody is correlated with that of the Pittavrata Vata. I don't know. Again, question comes here in Pittavrata Vata also, where the signs and symptoms are there nowhere which is similar to that of the hypertension. So it is very, very difficult to compare the Pittavrata Vata with that of the hypertension. The Pranavrta Udanamata, as the patients will present with maybe the hypertension once the hypertension has been developed, and developing the after developing the hypertension, the patients will present with an cardiac disorders, and the patient will present with the difficulty in and the difficulty in the breathing. So that may be the reason where some patients will present with the stiffness in the head or pain in the head. So that may be the these may be some presentations you may get it in the patients of hypertension. But again, these symptoms are developing the development of Hridaya Roga, are the difficulty in breathing, are the complications of the once the coronary artery disease sets in that particular patients you get the presentations of this. So the Pranavrta Udanamata maybe and once maybe some patients will present with Sirograha or pain in the head. But these are all the presentations are again maybe after the development of the hypertension, and once these develops the complications in that particular cardiovascular and the neurological complications are there. So in that particular way, we can compare with that. With Navrata Udanamata, again, the signs and symptoms are here. The patient will present with exhaustion, sometimes there may be a prostration. But again, these lakshanas are not similar to that of the hypertension. And Damani Pratichaya, somebody has correlated this one is under the Kapajan Anatmaja Vikara. Some people are saying this may be compared with that of the Damani Pratichaya mentioned in Kapajan Anatmaja Vikara. So again, this Damani Pratichaya is the Daman Nupale Paha, that has been told in Chakrapani. So it means that adherence of some substances, maybe in the form of arteriosclerosis or atherosclerosis or embolism, and anything which has been accumulated over the atherosclerotic plaques or atherosclerosis. So that kind of these are again complications of the hypertension, or because of these abnormalities in the blood vessels that may be causing the hypertension. So secondary hypertension, yes, Damani Pratishay can be taken under that particular heading. So another Kapajan Anatmaja Vikara also Ashtanga Sangra has mentioned Hridayopalepaha. So that's again we can say that secondary hypertension. For that we can take the word this one for secondary hypertension, not for the primary hypertension. And some people are comparing with that of the Raktavrita Vata. In Raktavrita Vata also there is an edema and reddish discoloration. These are all again related to the inflammatory skin disorders, where we cannot compare with that of the hypertension. I don't know why the people have been correlated with that. So in my opinion, it's very, very difficult to make a different nomenclature what has been given to the hypertension in Ayurveda. In my opinion, it's better to be in Avarna certain conditions mentioned as giddiness, headache, and fatigue. Based on that, some people are comparing and correlating with that of the concept of Avarna mentioned in Ayurvedic classical text. So before going to the disease further, so I wanted to know that because as I mentioned earlier, there are three important factors that has been mentioned for the development of this. One is the genetic factor, another one is the high salt intake, and the third one is adrenergic factor. So the Ahara is there any certain descriptions available in Ayurvedic classical text? I was just going through that just for the sake of interest. So because we say that in modern medicine, it is saying that Lavana rasa intake of Lavana rasa in excess should be limited, or it should be avoided, or limited intake of salt is advised to the patient. So excess intake of salt is going to cause the Lavana rasa is going to aggravate the disease further, and it is one of the causative factors for the development of the disease. But in the Ayurvedic classical text, in Madhura Rasa, excess intake of Madhura Rasa is responsible for the Staulyata. And again, this excess intake of Madhura Rasa is again responsible for the Alasyata, not at all interested in indulging any kinds of physical activities. And it also promotes the Tisopna. The patients are the people who consumes the lot of Madhura Rasa or indulging into the excess sleep. And also one more term is damani galopalepaha, damani lepaha. There will be deposition of certain substances inside the blood vessel. So considering this, so excess intake of Madhura Rasa, in my opinion, is one of the etiological factors for the development of the hypertension. So if the patient consumes the excess intake of the Amla Rasa is good to a certain extent, because Hridayam Tarpayati, Hridaya Tarpana is done by Amla Rasa. If it is being taken in excess quantity, and it is going to kapam vilopayati pittam abhivardate, because it aggravates the pitta, it brings the vitiation or the abnormalities inside the blood, and mamsam vidayati, and brings abnormalities in the muscle tissues, because once there will be a peripheral resistance is going to be developed because of this mamsam vidayati. And if there is a raktam dusha, if there is a rakta dusha is there, and that is going to cause the circulation defect in the blood, inside the body, and kaya sithilikara, because the body become the very sluggish and flaccid. And swaitum apadayati, again it is the cause for the, if it is taken in excess quantity, it is going to cause the swaitu. So in that way, the patients of Amla Pitta, hypertension patients should not take the Amla Rasa excess and the Madhura Rasa excess. The another one is in the modern medicine, what they were mainly concentrating on, don't give Lavana Rasa. They are only targeting the Lavana Rasa. But in my opinion, as an Ayurvedic Vaidya, I advise the patients to limit the intake of sweet, limit the intake of the Amla, sour taste, limit the intake of the Lavana. Lavana is again Vata, the contrary to that. When you are saying this as developing because of the Vana Bala Vadi or Vana Vikruti or defect Vana Bala Atiyo, something like that. So what Ayurveda says that it is Vatahara. So in that way, if you are considering the theory of Vana Vata Dusti, then Lavana Rasa can be given to the patients of hypertension. So, but it is going to cause the kapam vishandayati, margan vishodayati, sarva sharira avayan mrudu karoti. These are all the things which are in favor of giving the medicine should be this Lavana Rasa can be given to the patients of the hypertension. But it again, why it has been based on the it's a clinic pathological impact on the body, because it aggravates the pitta, and it aggravates the blood also. So that is the reason. So this particular because it is also causing it aggravates pitta, it exacerbates the rakta. It also sopan spota. It has been told that it burst out the sopa manifested in the abscess, then that kind of presentation. So in terms of the principles of Ayurveda, or in terms of the Ayurvedic these things, so the salt or the Lavana Rasa should not be given to the patients of hypertension. We cannot say, if we are considering the theory of Vanabala Prakopa and some the Vata, if it is in Vata Bala Pradhana Vadi, if we are considering the based on that, so the Lavana Rasa can be advised to the patients of hypertension. But as you know that once the person consumes the Lavana Rasa in excess, so that is going to aggravate the blood pressure readings. So that may be the reason. But in terms of, in my opinion, the excess intake of sweet, sour, and salty should be restricted. Not only what the modern medicine people are saying, restrict only the salt-restricted diet. In my opinion, based on the principles of Ayurveda, all the Madhura, Amla, Lavana, Rasa should be taken in limited quantities. So in the Katuka Rasa also, where this Leshmanam Samayati and this Marutajan Vikaran Upajanayanti. So if the person who takes if you are taking the Vanavala Siddhanta, because excess intake of Katu Rasa is going to cause the Maruta Vikaram Janayanti. If you take up the excess intake of the Tikta Rasa, again it is going to cause the Vata Vikaran Upajanayanti, Srotaswam Upadayati, like that presentation will be there. And if we are taking the excess intake of the Kashaya Rasa, this Kashaya Rasa should also be limited, maybe because Hridayam Pidayati, Srotam Savabhadnati, then Vata Vikaran Upajanayati. So like that. So the once the patient has been suffering from the hypertension, so there may be an wise eating plan, dietary plan should be adapted to the patients. So as I mentioned earlier, so this can be compared with that of the Avyakta Pururupa of the Vata Vandis are clearly mentioned that Avyakta Lakshanam Tesam Pururupam iti Smritam Atmarupam tu tad avyaktam apayo laguto punaha. Atmarupam tad avyaktam. So the clinical presentations are very mild in nature, or the presented clinical symptoms are the very mild symptoms are there, are not clearly exhibited and manifested. So that is the reason. So it becomes very, very difficult to diagnose these particular diseases. So next comes about what are the clinical presentations, what has been mentioned in the Ayurvedic classical text based on related to the hypertension. We can call it as the patients will present with the Sirashula, some patients will present with the Durbalata, some patients will present with the history of Nidralpata, some patient will present with Siragurnam, so maybe in Chakkar type ka, Chittavasada and Swasa, Rutspandana and Brahma. These are some of the Vata Viddhi the patients will present with the Vata Ruddhi Lakshanas. So that's why to a certain extent we can say that it is Vata Pradhana Vadi. So that is why when it comes to this Vata, because in my opinion, so it is a disease manifest by involving Vata, Pitta and Kapha in an equal proportions. Maybe the involvement of the role of Vata may be more Ruddhi Tama in compared the Pitta and Tara, maybe Kapha and Pitta in Tara. Ruddhi Tara and Ruddhi Tama is Ruddhi Tara. So the other three are it reduces a Pradhana Vadi, because this excess aggravation of the Vata which make the Sankocha of the blood vessel brings Sankocha, and the Damana Pratichaya in case of the Kapha Prakopa, and that is going to cause the Rasavai Srotos Avaroda, and as a result of that there will be an Vaisamyata in the Vanavata. So that as a result of that there will be increased Vana Bala, Vanavayu Bala, and this because the Vanavata is responsible for the circulation of the Rasa and Rakta all over the body, and the Vanine Rasadaturi. So this if it has been obstructed by any of the for its normal movement, because aggravation of Vata can be taken place by two important factors. One is diminution of the dhatus, another one is there is an obstruction for its pathways. So because of that there will be an aggravation of the Vana Vayu Bala, and that will leads to the rasa, then decreases the rasa tarpana to the other dhatus, and as a result of that there will be mild features of peripheral rasa dhatu kshaya lakshanas may be presented in the patients, and decreased veda and increased kaphamala will be there, and Vana Vayu Bala, why it has been Kleda Nirvana, the Kleda Nirvana is again done by the Apanavata. So that's why these are all some of the theories which have been in favor of saying that Vata, Pitta and Kapha, all the three are important. If you go to the Samprapti while explaining the Samprapti of the disease, so where Vata, Samanavata, Vanavata, Pranavata and Apanavata, all the four are involved. Why I am saying this? Because this Samanavata is responsible for the movement of the which is situated very near to the Agni, and this is also involved in the development of the disease hypertension. And Vanavata, as I mentioned, that Vana is responsible for the circulation. So if there is a defect in that, in defect in its normal pathways, that is going to cause. And Pranavata, why it is Pranavata is mentioned? So because the Pranavata is situated in the brain, and in the brain is again because the blood circulation and is again controlled by the autonomic nervous system and the central nervous system. And if there is a defect in the pranavata, it is not going to coordinate properly with that of the heart, and that may be the factor. So based on that, we can consider pranavata also. And why apanavata is included? Apanavata is, as I mentioned earlier, there is in case of the in certain conditions. So kleda nirvahana is done again by the apanavata. So if it is kleda nirvahana is not properly maintained, that's sodium retention will be taken place, and as a result of that, there will be development of the hypertension. So sadhaka pitta is present in the heart itself, and if any defect in this, it is going to cause the normal functioning of the heart. Even some people are claiming that there will be an the stimulation starts from the SA node to till the Purkinje fiber. So that work has been done because Pranavata is situated in the heart and does this kinds of work. If there is any defect in the Pranavata, so that is going to cause the disease associated with the sadhaka pitta also. Avalambaka kapha, pachaka pitta is also there. Pachaka pitta involvement is also there because of the variations in the basal metabolic rate is again governed by pachaka pitta and agni. Navalambaka kapha is again, in my opinion, there will be the blood vessels are governed by the kapha itself, because slis alingane, the functions of mata kapha is the maintaining the integrity of the blood vessels. So if there is a continuous increased vata which is going to affect the blood vessels, and to a certain extent kapha is going to prevent that one by a certain extent, but continuous excess increase of vata is going to bring the dusti in the avalambaka kapha. As a result of that, there will be a development of the hypertension. So what are the other doshas? Maybe the rasa and rakta together can be considered as the blood, and then there is a defect in that is going to cause this thing. And then kleda, as I mentioned earlier, and damani and sira, sveda and mutra, or any defect in either of these things. So that's going to cause there is a defect in the mutra nirvana, there will be a defect in the sveda nirvana, and defect in the sira and damanis, it's going to cause the hypertension in patients. So what are the srutas has been involved? As I mentioned earlier, it's a complex disease involving the multi-system failures, like coronary heart system, cardiovascular system, central nervous system, and genitourinary system. So that's why this is a multi-organ system. That's why there is an involvement of the srotas are pranavaha, rasavaha, raktavaha, medavaha, mutravaha, and svedavaha, and udakavaha. In any of these things, any defect in any of these particular srotas, either independently or combined together, will develop the hypertension in case of the patient. So, for example, if there is a homeostasis of the homeostasis or hemodynamic, there is a defect in the hemodynamic mechanism inside the body because of the udakavaha variations, because of the pressure. There may be an increase hydrostatic pressure or decrease oncotic pressure. So that will be indirectly influencing in the normal circulation of the blood. So that may be the reason where the homeostasis of the dosha is along with associated with the homeostasis of the dhatus, associated with the patency of the srotas is also very, very important. Any defect in that is going to cause the disease hypertension. So this srotodrushti lakshanas are the sangha, vimarga gamana, and siragranthi. In certain diseases, sangha, there will be an as a secondary hypertension, as I told, there will be thrombosis, embolism, arteriosclerosis or atherosclerosis, and vimarga gamana, where there is because of the obstruction for its normal pathways, and it goes into the different pathways, and siragranthi in the like coarctation of aorta and all. So adhisthana is the Rudaya and Sarva Sariragata, and Kavaigunya, especially in the heart, brain, kidneys, and the eyes and blood vessels. So that's why these are the organs are the Adhisthana. Agni is most of the patients will present to you with an history of most of the patients of hypertension will comes to you with a history of disturbance in the blood in the digestion mechanism, and the patient will say that there is an excess manifestation of the gas inside the body, and there will be a defect in the some patients will present with the distension of the abdomen, with the passage of the excess passage of the flatus and all those things. So in that may be the presentations of the Mesomagni or Mandagni features. And the Sancharasthana is it is circulating all over the body through Sirayanis, according to Ayurvedic concept. And Udbhusthana is as it is an Vata Pradhana Vadi. So that's why it is originated from the Pakwasha and Amashvata. That's why the Basti may be advised in the patients of hypertension to get better results. So that's why this Moolasthana can be covered it out. So what may be the Amayam Avarna? Some people, especially in case of the secondary hypertension, so there may be some Anyadosa Avarnas, like because of Kapha and Pittavruta, Anyadhatu Avarnas, especially Meda and Raktavruta, and Anunya Avarna, as mentioned with Vanavala, Vanavruta Pradhana, Vanavruta Prana. So these are all the unknown Avrita Vata. Vanavruta Prana is again one of the there is an defect in the autonomic nervous system, functions of the autonomic nervous system. So that may be the causing the disease. So that's may be correlated with the unknown avarna. And the Annapita, that's Pittavruta and Pittavruta Vana and Pittavruta Samana, and these kinds of presentations are also some people are, because in all these conditions, patients will present with the history of headache, fatigue. The patients will present with headache and the fatigue. These are some of the vague presentations are there in these conditions. So treatment of can be initiated based on the it may be planned based on the person to person, and because these maybe some people are developing the hypertension because of Vata or Dusti, some people may be developing because of the Avarna by Kapha and Pitta, and some people may be developing because of the this Vanavayu Prakopa. So depending on that, the treatment needs to be advocated to the patients. This has been this I have taken to say it as in case of winter there is an increased blood pressure, and in case of the summer there is an decreased blood pressure. So the cause may be because of the temperature variations or environmental influences. That may be the causative factor which may be influencing these things. So if we go to the epidemiology of it, and it is distributed more in the urban areas, and it is most commonly affecting the blacks than the white, and 15 to 20% of the adults in Indian population and all over the world, epidemiology this is, and many millions of Indians have been suffering from this particular disease very recently. So this particular the hypertension, there is an blood pressure values occur within a continuum process, and it is determined by the mechanical, hormonal, and the environmental factors. So that's why I told this environmental factors, and variation in the temperature will influences on the readings. So every rise of the systemic blood pressure, it rises with the age, and there is an incidence of cardiovascular diseases increases. So the cardiovascular risks associated with the blood pressure is depending on the combination of the risk factors, especially the old age, the male gender, overweight patients or the obese patients, lack of physical activity, history of smoking, family history of hypertension, increased cholesterol, liver or hyperlipidemia or dyslipidemia, history of diabetes mellitus, and pre-existing vascular disease. All these will contribute in the development of hypertension. So this particular definition of the hypertension, as mentioned in the British hypertension medical classification, so it has been mentioned starting from optimal blood pressure should be less than 120 and less than 80. Normal is less than 130 to 85. And high normal is 130 to 139 and 85 to 89. And the hypertension has been graded 1, 2, 3 as the grade 1, 140 to 159, and the diastolic is 90 to 99. In grade 2, it can be considered moderate hypertension, 160 to 179 and 100 to 109. Grade 3 severe hypertension greater than 180 and greater than 110. So the isolated hypertension, again, grade 1, 140 to 159, less than 90, and grade 2, less than 160 and less than 90. So this is the definition which has been given for the hypertension. So this hypertension can be studied in terms of its etiological factors. The 95% of the patients, we don't know what may be the cause for the development of this disease. So Sankshipta Kriyagu Nidana Parivartanam is very, very difficult to implement in this because you don't know what exactly is the causative factor which is responsible for the development of the patient. That's why it's very, very challenging. Number two, this is the common presentation in case of the essential hypertension, but in case of secondary hypertension, particular condition is developing the this thing. So we don't know exactly what may be the causes for that. So this in case the secondary hypertension may be developing because of the renal dysfunction, peripheral resistance of the vessel tone, endothelial dysfunction, autonomic tone, and insulin resistance, and the neurohumoral factors are also causing the influencing the development of secondary hypertension. And the obesity, pregnancy, the preeclampsia, renal disease, especially the parenchymal renal disease, particularly glomerulonephritis, renal vascular disease, polycystic kidney disease, where the patients will presenting with the history of hypertension. The other causes are the pheochromocytoma to that of the thyrotoxicosis. And if the patient is diagnosed as a thyrotoxicosis, and once you are managed with the proper medications, and once you are treated with that and hyperparathyroidism conditions and the primary aldosteronism, all these conditions, if you're treated with the proper medications, so primary hypothyroidism, if you're treating the patients, if the patient is suffering from hypothyroidism and you are maintained with the proper medications, then naturally the patients will blood pressure will comes to normal. So no need of antihypertensive given to those patients. So that's why you need to understand what is the cause for the development of the disease. If there is a history of oral contraceptives, pills, especially the drugs containing estrogens, anabolic steroids, corticosteroids, NSAIDs, carbenoxolone, and sympathomimetic agents. And when you are taking these things and when you are taking the history of the patient, so ask the patient to either change the drugs or stop the drugs. Otherwise, once you stop that, the blood pressure becomes normal. But if the patient is taking these drugs for a longer duration and if it is made a damage to the kidney, and then it becomes very, very difficult. And if there's a coarctation of the aorta, that's also causing the hypertension. So the other secondary causes of hypertension is, as I mentioned earlier also. So this is in some ethnic groups, African Americans and in the Japanese, it's very, very common. And and about 5% of the patients can be a specific disease or abnormality leading to the sodium retention and the peripheral vasoconstriction because of some genetic factors. And causes of the secondary hypertension is again, as modern medicine says, that high salt intake, heavy consumption of alcohol, obesity, lack of exercise, impaired intrauterine growth. There's a little evidence that stress causes hypertension. We say that the stress may not be the causative factor for the development of the disease, but once the disease has been diagnosed as an hypertension and the patient is suffering from hypertension, that will aggravate the blood pressure readings. But there's a little evidence to say that stress is the causes for the development of the hypertension. So what may be the approaches should be given in case of the newly diagnosed hypertension? Hypertension is again predominantly an asymptomatic condition. Usually this has been diagnosed when your routine examination or when the complications of the disease, because of the hypertension, if the complications are arises in the form of stroke, ischemic and stroke hemorrhagic or coronary artery disease or kidney disease or the eye disorders. So that's why the BP is advisable for every 5 years in the adults. So the objectives of this initial evaluation of the BP readings is to obtain accurate representatives of the BP readings, and the underlying cause should be addressed as one of the risk factors, because to quantify to detect the cardiovascular risk and to minimize the complications of the end organ damage. So that's why diagnosis of the secondary hypertension at the earlier is very, very important. So what are the goals should be obtained? There are three important goals. One is careful medical history, clinical examination, and some simple investigation needs to be carried out to diagnose what may be the different conditions will be there. So you know that the measurement of the blood pressure should be made nearest to mmHg in the sitting position with the arm supported, and it should be repeated after 5 minutes if the first reading is very high, or if the patient comes from outside and if the first reading is very high, ask the patient to relax for 5 to 10 minutes and then take the second blood pressure reading. And to avoid the spuriously high readings in the obese patients, the cup should be contain a bladder that encompasses at least 2/3 of the arm circumference. That's the I told many times to the my patient, my students, that the arm circumference should be covered. 2/3 of the arm circumference should be covered. That cup, blood monitoring cup, should cover the 2/3 of the arm circumference. Then only we can get the accurate results. What we're using in our OPD setup is we're keeping the same BP machine, and that maybe if the patient of obese comes, that may not be suitable for that. That's why different size cup should be kept in your practice, so that we can monitor the blood pressure accurately, whether it is obese or the lean patients. Another important is the home and ambulatory BP recordings are advised in certain conditions. Especially this is very, very important, and because in exercise, anxiety, discomfort, and unfamiliar surroundings can also contribute in the transient rise in blood pressure. So that is why if the sphygmomanometry, if the blood pressure has been monitored performed by the doctor in the hospital, if there's an unrepresented increase in the blood pressure, that's called as unrepresented surge in the blood pressure. So that can be termed as white coat hypertension. But 20% of the patients with this particular history may have an high normal blood pressure that is recorded by the automated devices at home. That's why the white coat hypertension patient should be understood based on this home automated devices used at home. So the normal result, but if the patient monitored by the doctor, may be given the excess. That's called as white coat hypertension. The another one is the 24-hour ambulatory machines. The 24-hour ambulatory BP recordings are done closely over a period of 24 hours to see the fluctuations in the blood pressure readings from morning to evening. So that can be used, and that can be simply attached to your body for the assessment of the blood pressure to know what kind of variations are there. So the home and ambulatory BP recordings are very important in labile hypertension patients, because in these patients there is a frequently fluctuates between normal and high, changing more dramatically than the normal. That's called as labile hypertension. To diagnose labile hypertension, so the home and ambulatory blood pressure monitoring machines are very, very useful. And the refractory hypertension is uncontrolled blood pressure despite the use of 5 or more antihypertensive drugs. So that's why in that particular condition, home and ambulatory blood pressures are helpful to understand, to diagnose these two conditions. And symptomatic hypertension, some patients will present with the hypertension as we can find it in case of the blood sugar, that is in diabetes patients. Some patients will repeatedly undergo the hypoglycemia state, but in case of the diabetic hypertension patients also, there may be symptomatic hypertension. And the white coat hypertension, to monitor all those things, ambulatory BP machine and home device is necessary. So another one is the medical history is very, very important. The family history of the hypertension in the family member, history of the exercise and salt intake and smoking habit should be recorded along with alcohol. Other risk factors and they should be noted while you're taking the family history, medical history. In the medical history also, it also gives the pheochromocytoma. The patients will present with paroxysmal headache, palpitation and sweating, or complications of the coronary artery disease, that is angina, breathlessness. These are all the presentations will will indicate the pheochromocytoma with the clinical presentation of paroxysmal headache, palpitation and sweating, and angina and breathless indicate towards the coronary artery diseases. So under the on examinations, when you are examining the patient, so there will be a radiofemoral delay, that's a coarctation of the aorta, enlarged kidneys, and the abdominal broods will be there in case of renal artery stenosis. And the characteristics of the faces, especially habitus of the Cushing syndrome, these are all some of the presentations we will get it on examinations. Radiofemoral delay, enlarged kidneys, and abdominal broods. And the central obesity and the hyperlipidemia, tendon xanthosomas, you might have seen it in the face. And the most abdominal other signs are developing because of the complications of hypertension. So some patients will present with the history of left ventricular hypertrophy, that's called as apical hue, accentuation of the aortic component of the second heart sound and the fourth heart sounds. So the examination is very important. All hypertension patients should undergo the optic fungi examination because this will give us an evidence about the generalized atheroма in other part of the body, and it also helps to identify the aortic aneurysm or peripheral vascular diseases. So the target organ damage, blood vessels in the larger arteries are more than 1 meter diameter. The internal elastic lamina is thickened and the smooth muscle is going to be hypertrophied, and the vessels dilate and become tortuous, and their walls become less complex. So this is going to be happen in these patients. And the end organ damage can also be, target organ damage can also be seen in smaller arteries, as in case of hyaline arteriosclerosis occurs in the wall. The lumen narrows and aneurysm may develop in these patients. So widespread atheroma develops and may lead to coronary and cerebrovascular disease. This can be compared with the Damani Pratichaya, Damani Upalepa, this kinds of word which have been told in our Arabic classical text, or Derudaya Upalepa. The target organ structural, the presenting with the there will be structural changes in the vasculature of the patient, increasing the peripheral vascular resistance and reducing the renal blood flow, so thereby activating the renin angiotensin aldosterone axis. So hypertension is again the major risk factor in pathogenesis of aortic aneurysm and the aortic dissection. So central nervous system complications are the stroke is a common complications of hypertension, and it may be due to cerebral hemorrhage or infarction. Carotid atheroma or transient ischemic attacks are more common in hypertensive patients. Subarachnoid hemorrhage is also associated with hypertension. So these are also pictures which are indicating the cerebral infarction and the subarachnoid hemorrhage in the patients of hypertension. So in the hypertension, encephalopathy is a rare condition developed because of the high blood pressure and neurological symptoms, including the transient disturbances of speech or vision, paresthesia, disorientation, fits, and the loss of consciousness, and the papilloedema, swelling of the optic is very, very common. The retinal examination through the optic fundi will also reveal the changes related to the hypertension. So fundoscopy, therefore, will provide the arteriolar damage occurring elsewhere. So the cotton wool exudate can be seen on examination of the retina, and hard exudate can also be seen in the patients of this hypertension uncontrolled patients. So this is you can clearly seen that malignant or exudated phase of the hypertension, where in this the patients will presenting with thickening of the arterioles, and these particular hemorrhages with the dot, blot, and the cotton wool and hard waxy exudates can be seen in this particular, along with the papilloedema. So the malignant or accelerated phase of hypertension is accelerate the macrovascular damage with necrosis in the walls of the arteries and arterioles, and the malignant accelerated hypertension is again done by evidence of the high blood pressure. End organ, this is again rapidly progressive end organ damage, such as retinopathy will develop, renal dysfunction will be there, or hypertensive encephalopathy. So they sometimes in patients will develop a left ventricular failure and may occur if it has not been treated. So the patient may die within months. So what are the investigations? Some simple investigation needs to be done. urine analysis for blood and the protein and the glucose. And in case of the blood urea and electrolytes and creatinine should be assessed. And in case of hypokalemic alkalosis, so that can be indicated towards the indicates towards the this particular aldosteronism. Then blood glucose level monitoring is very important. And serum total and SDL cholesterol or total cholesterol should be done. And thyroid function test in case of the hypertension patients. And ECG, 12-lead ECG is also important to know the left ventricular hypertrophy and coronary artery disease, and chest X-ray to detect the cardiomegaly, heart failure, and the coarctation of the aorta. So the hypertension may be some investigations, maybe ambulatory blood pressure regarding to assess the borderline or the white coat hypertension, and echocardiogram is also helps to detect or quantify left ventricular hypertrophy. Renal ultrasound, especially in case of the renal artery disease, and renal angiography and urinary catecholamines and urinary cortisol and dexamethasone can be advised in the patients of the this thing. So the particular the plasma renin activity and aldosterone, these are very rarely done in a patients of hypertension. So this excess salt intake and the lavana sevana, again what I mentioned, Prokopavardayati and Raktavardayati, these are all mechanism that has been told, increase in the venous return, increase in the stroke volume, increase in the cardiac output, and increase in the blood pressure and development of the hypertension. So the staulya or the increase in medu dhatu is again causing the favoring the development of the atherosclerosis or the mani patichaya or the mani upalepa, and then there have been peripheral resistance, the hyperinsulinemia, salt water retention, increase in stroke volume, vascular muscle hypertrophy will be there, increase in the total peripheral resistance, and increase in the blood pressure that is going to cause the hypertension in some patients. So it is also some correlations can also be made based on the Vata Prakopa that I told. Sympathetic overstimulations will be there, and increase in the that leads to increase in the heart rate, autonomic sympathetic nervous activity, and increase in the cardiac output and vasoconstriction, increase in total peripheral resistance can cause the hypertension. What is the management principles? What has been told in case of essential hypertension, 92% of the patients, 95% of the patients are presenting with the unknown etiological factor. But in certain patients, as I mentioned, the certain risk factors, modifiable risk factors are there. So you can include those in those patients. We can adapt these the healthy lifestyles and the strict dietary pattern. The limited intake of the sweet, sour, and the salt diet should be advisable to the patients of hypertension. And what kind of treatment can be advised based on the depending on the different conditions. Mutrala drugs and methyl drugs can be given in case of the patients who are developing because of the some unknown etiological factors without involving the other complications. But if there is an involvement of the renal system, then you can use the Mutrala drugs and methyl drugs can be combined together. Punarnama, Varuna, and Gokshura, Brahmi, and Sankapushpi, and Jatamamsi, each 500 milligram, and Vacha 250 milligram. This should be given as BD dose. And in certain patients, if there is an Hridayopalepa, some presentations will be there, along with that Vatagna drugs like Arjuna, Kamala, Satavari, Pushkaramula, Parangi, and Chitraka, Trikatu, 500 mg/d that can also be given to the patients. And if the patient is having the history of obesity, then that should be treated with the Trifla 2 gram plus Musta, Vrat Panchamula, and Vidanga each 1 gram. And Ela plus Avakshara each 250 milligram, Loha 125 milligram BD, Kanchana Gugulu 500 mg BD, and Tripla Gugulu 500 mg BD can be given if the patient is obese. The patient with the tachycardia, then Prabhakarvati with 125 mg Satavari, and Arjuna Brahme 1 gram with BD, and hypertension with bradycardia, then Pushkaramula, Devdaru, Barangi, Amlaki, Satavari, and with Sunti, so that that can be given in the patients of hypertension with a history of bradycardia. So what are the single drugs can be advisable in a patients of hypertension is Sarpagandha Churna, Ashwagandha Churna, Jatamamsa Churna, Arjuna Twak Churna, Arjuna Kshirapaka, Rasona Kshirapaka, Rasona, Brahmi, Tagara. These are all can be administered, and then the patient blood pressure can be monitored depending on that. So you can increase or decrease the dose, or you can add on the one single drug or combination of the formulation. So Sarvagandha Ganavate is one of the best drug in terms of the management of the hypertension, and Pushkar Brahmi Gugulu is also one of the best drugs. So along with that, the patient Brahmivati, Prabhakaravati, and Arjuna Arista and Pravalapisti can be advised to the patients of hypertension. And the Sweta Parpati, Nagarjuna Brasa, and Dharnavarasa, Mukta Bashma, and Akika Pisti. The dose has been mentioned clearly, that's 125 mg BD in all the conditions except in Sweta Parpati, 500 mg BD can be advised. So again, these are all the things which we need to, should not be given in the long run, depending on the secondary causes. Then treat those conditions, and then once the condition is, secondary condition is treated, so then you can stop these medicines and continue with the single drugs as I mentioned earlier. So the Pushkar Brahmi Guglu 250 mg BD and Gopsurati Guglu, some patients are well managed with these drugs. These drugs are very effective in maintaining the blood pressure level. And this is the drug work has been done by Vijay Srivastav using the Baduyasti, Jatamams in Gopsur and Vatsanaba in Group A. And in Group B, Jalanimba, Sarpagandha, Pnanava and Vatsanava had been done. And he found that these drugs are very, very effective in controlling the blood pressure, not only with blood pressure, but also good in relieving the headache, palpitation, dizziness, insomnia, and the constipation. Most of the patients will needs an Vatanalomana therapies, and that can be achieved by those drugs. So Samshodhana Chikitsa that has been done is the Virechana and Erandatela with the Basti, the Karma, that is Lekana Dravya and Mutrala Dravya, etc. And Shuru Basti and Shuru Dara, depending on the patients, you need to plan it out. And along with that, there will be Samshodhana Chikitsa, Lekana Basti, if the patient is obese, and Virechana Karma with Castrol can be advised. And the Sirodhara with Takradara or the Kshiradhara or the Jaladhara or the Asirodhara with medicated oils can be used depending on the different conditions, and Rakta Mokshana can be done in some patients. So Rasayana therapies are some Rasayanas or Brahmi Rasayana, Sankupushpi Rasayana, Estimada Churna, Guduchi, depending on the patient's need and patient's psychological status. And the immune status also. So what kind of yoga can be advised in the patients of hypertension? Everybody is saying that this yoga will help to relieve stress and the hypertension, and it will also help to regularize the sleep pattern. Sleep regulation can be achieved by yoga. So this is also the regular practice of yoga will also helps to come down the obesity. It also helps to give rise to the body, energy to the body and mind. It makes more happier, and then it will helps to regulate the blood pressure level. So what are some of the asanas can be mentioned? That is the child pose provides an opportunity for calm and relaxation. This is an easily procedure that can be done easily. So Baddha Konasana, bound angle pose. This can be done very easily by the patients. Sukhasana, an easy pose, spending a quality time to his or her body and sitting in a proper posture. Bhujanga Asana, that is Cobra Pose, this can be done regularly. And the Setu Bandhasana, this can also be done regularly. The patients of hypertension patients should done this. Viparita Karani, the legs up the wall pose, this is also very, very good and effective in case of the hypertension patients. And the Savasana is very, very important. Actually, after once the asanas are completed, that you should end up your exercise with that of the Savasana to relax the all body cells and tissues, including the organs and the systems. So what are the pranayamas can be advised? Another one is the Brahmari pranayama and another one is Nadi Shodhana. These are very excellent. If the patient is obese and android obesity is there, in that particular condition, Kapalabhati can be advised to the patients of hypertension. Meditation is again one of the very important practice, yogic practice, because this will help to increase the study of concentration, enhances the concentration also, and deep breathing, meditation, and progressive music relaxation and yoga nidra, depending on the patient's need. You need to undergo under the consultation of meditation experts. And the quantification, as I mentioned earlier, coronary artery disease, stroke, and heart failure are the common presentations of this hypertension. So that is why the relative benefits is the proper medicines is, if we're managing with that 30% reduction of the risk of the stroke, 20% of the reduction of the coronary artery disease can be done in all age groups with proper medications. So the most hypertension, excess morbidity and mortality associated with hypertension contribute to the coronary artery disease, and many treatment guidelines are you mentioned for the prevention of that. And the threshold for intervention is systolic and diastolic blood pressure are both powerful predictors. Not like, if it is the only diastolic increase and systolic is normal, then you cannot take the medicines. No, both should be monitored properly and wisely. And the threshold patients with diabetes and cardiovascular disease are especially high risk of threshold for initiating the antihypertensive therapy. Therefore, level in these patients group there should not be, blood pressure should not be more than 140/90. Then you start the medicines immediately in the patients of cardiovascular disease or in the patients of the stroke. So diuretics or the beta blockers are also shown to reduce the risk of the cardiovascular disorders. The treatment target should be the reducing the blood pressure between 139 to 83, and treatment target also should the appropriate treatment and allow step up lifestyle modification in first line drug therapy if they fail to control the patients of blood pressure. If the appropriate to advise the patients to use proper lifestyle and the diet therapy so that we can control that with these two in the initial phase if it has been newly diagnosed hypertension patients. But if it has not been managed or if it has not been controlled with that particular thing, then we need to use the antihypertensive drugs in those patients. And the patients who are taking the antihypertensive patients, once you are starting the antihypertensive drugs, and ask the patient to make a regular checkup at an interval of 3 months interval to monitor the blood pressure level, and also to understand what are the side effects of the antihypertensive drug, and also to reinforce the lifestyle advice to the patients. The non-drug measures, as I mentioned earlier, appropriate lifestyle is very, very important in patients who are newly diagnosed. And the non-drug therapies should be, the target should be reducing the obesity, correcting the obesity, or reducing the alcohol intake, restricting the salt intake, taking regular physical exercise, increasing the consumption of the fruits and vegetables should be promoted, quitting smoking and eating the oily fish, and the adopting the diet which is low in saturated fat may produce further reductions in the cardiovascular disease. So these are all the some of the things which the patients of hypertension should follow strictly. And the anti-hypertensive drugs and thiazides and the other anti-diuretics, and the mechanism of action of these is incompletely understood, but still these patients will be uses of these drugs will maintain the helps to contain maximum blood pressure can be controlled with this. And antihypertensive drugs like appropriate daily dose is 2.5 to mg to bendroflumetazine 0.5 mg, cyclopentazide should be given, and more potent loop diuretics, especially furosemide 40 mg daily or bumetanide 1 mg daily, have a few advantages over the thiazides in the treatment of this hypertension. And this can be given with the AC along with the AC inhibitors. So these AC inhibitors are enalapril and 25 mg daily, ramipril 5 to 10 mg, and the lisinopril 10 to 40 mg. And there should be care should be taken in these in particularly care in patients with the renal function, impaired renal function, renal artery stenosis, because they can reduce the filtration pressure in the glomeruli and precipitate the renal failure. So that's why in these patients, this AC inhibitor should not be given. And electrolytes and creatinine should be checked before 1 to 2 weeks after the commencement of the therapy. And some of the few side effects with the patient presenting with hypertension, cough, rash, and hyperkalemia and the renal dysfunction. So angiotensin receptor blockers like irbesartan and valsartan can be advised to the patients. And these they do not have they do not cause cough and they are better tolerated. If the patients of the with there will be a history of the blood cough with the AC inhibitors, then stop the AC inhibitor and switch on to the angiotensin receptor blockers in those patients. Calcium channel blockers can be advised with the doses of amlodipine 5 to 10 mg daily and nifedipine. And these are well tolerated, especially in older age people. So this can be calcium channel antagonist should be advised in older people. And the side effects are palpitations, fluid retention, and flushing can also be looked into. Calcium channel antagonist can be diltiazem and verapamil can be given, but they can cause bradycardia. That also you need to look into it. And so the main side effect of verapamil is again causing the constipation. That also you need to take care. Beta blockers, there are no, in the earlier days, the beta blockers are considered to be in the first line of drug. But nowadays, these are no longer the first line of drug, but except in patients with another indication for the drug, especially angina, then you can advise these beta blockers. So metoprolol and atenolol and bisoprolol can be advised in the patients with angina, hypertension with angina. And the levetolol and the carvedilol can be advised. And this levetolol is very, very important if the patient is uncontrolled, the hypertension is there. So then IV infusion of the levetolol can be advised in case of malignant phase hypertension. So the other drugs can be used, varieties of drugs like progesin and dexosin. The patients are not well tolerated with the earlier drugs. And other drugs like adrenergic and minoxidil can be advised if the earlier drugs, the first line drugs are failed to control the hypertension, or the first line drugs can induce the maximum side effect. Then those conditions we can switch on to this. So the minoxidil can also causes the increased facial hair and therefore unsuitable for the female patients. So that's why minoxidil should not be given in case of the female hypertensive patients. So the hypertensive encephalopathy, the nitroprusside and nicardin should be given in those patients. So then if the patient is suffering from the stroke, then nicardipine and levetolol and nitroprusside can be given. With myocardial infarction and unstable angina, nitroglycerin and nicardipine and levetolol and esmolol should be advised, like that, etc. The another important choice of anti-hypertensive drugs is also very important. Calcium antagonists and AC inhibitors and angiotensin receptor blockers have shown the consistent difference in outcome, efficacy, and the side effects of the quality of life. So beta blockers, which previously featured as first-line therapy in the guidelines, have also weaker evidence base nowadays. The choice of is again dictated by the patient's age and ethnic background should be taken into consideration before prescribing the medicines. And the cost and the convenience of the also influences the exact drug and the preparation of the drug should be used. Response to initial therapy and the side effects of the guide, which will also, because the response to the initial therapy and the side effects will also guide the subsequent treatment procedures. The comorbid conditions also have an influence in the drug selection. Example, beta blocker might be the most appropriate treatment for patient with angina. Thiazide diuretics and dihydropyridine calcium channel antagonist are the most suitable drug for the treatment in the older age people. So although some patients can be treated with a single antihypertensive drug, the combination of drug is often required to achieve the optimal blood pressure and to minimize the adverse reactions of the single drug. So the combination therapy is also very desirable because the low dose therapy with the two drugs may reduce the fewer unwanted effects than the treatment with maximum dose of the single drug. So that's why some drugs combination have supplementary, complementary, or synergistic actions. For example, thiazides increase activity of the renin-angiotensin system, while the ACE inhibitors block it. So that's why the accelerated phase of hypertension and lowering the blood pressure BP very too quickly may compromise the tissue perfusion. So that is why they can cause the cerebral damage and including the occipital blindness and precipitate the coronary or renal insufficiency. So that's why the reduction of the blood pressure should be done over a period of 24 to 48 hours. And in most patients, it is possible to avoid the parenteral therapy to bring the BP under control with bed rest and the oral drug therapies. And if it is necessary, if the patient is not possible to give orally, intravenous or intramuscular labetalol can be given depending on the patient's need. So the refractory hypertension is again, there may be a non-adherence to the drug therapy, inadequate therapy, failure to recognize an underlying cause can all contribute to that, and accordingly, the treatment needs to be initiated to the patient. And the adjuvant drug therapies are the aspirin, and the aspirin is the mostly prescribed, and the statins are mostly ecosprin, and the aspirin and the statins are the two important adjuvant drugs are mostly prescribed by the modern doctors in most of the hypertensive as well as ischemic heart disease patients. So the choosing the drug is again very important because if there is a hyperlipidemia, then start the statins. Coexisting disease may be a contraindication to the therapy. That's why hypertension patient might be prescribed beta blocker if they have left ventricular impairment, but not if they have asthma. If the patient suffering from asthma, beta blocker should not be given to those patients. So the patient adherence to therapy is very important. And another, when you are prescribing the medicines, you should also take care that simple dosing schedule or easier administration is very important. So once it, for example, enalapril once daily rather than captopril 3 times daily for hypertension. So you choose a drug so the once a daily is more convenient than the 3 times a daily dosage. So the preventive measures is, as I mentioned earlier, I will not go into that. Again, it's a repetition of it, regular physical activities, smoking cessation, reduction of the alcohol intake, dietary restriction of the salt, and these are all some of the regular practices one needs to adopt that one. And ask the patient to indulge in more physical activities, and ask the patient to indulge barley, sorghum, wheat, green gram, horse gram, bitter gourd, bottle gourd, and turnip. These are some of the can be advised. And the carrot, radish, cucumber, and all these vegetables can be along with fruits. The excess intake of salt should not be advised to the patients. Along with that, not only salt, excess intake of sweet and sour should be avoided, and alcohol consumption and smoking should be avoided. So these are the references which I have taken, and I am very much thankful to my colleague Dr. Vijay Srivastav and Dr. Ajay Pandey and Dr. Arunima PS for their inputs while preparing this lecture. Thank you very much. If any of the questions are there, I'm ready to take up. Over to you. So I will come out of this presentation. Okay.
डॉक्टर साहब बहुत बहुत धन्यवाद आपको। आपने जो जिस ढंग से हाइपरटेंशन को आधुनिक परिप्रेक्ष्य में प्रस्तुत किया, उससे छात्र बहुत लाभान्वित हुए और ये हम लोगों को एक नया ज्ञान प्राप्त हुआ आपके द्वारा। बहुत शोधपूर्ण आपका आलेख था। बहुत बहुत बधाई, धन्यवाद।
It is not audible to them. Poonam ji, shall I leave? Okay. Yes, yes, it is audible, audible. Please. Thank you.